sir?
Good.
Good. My name's Courtney. I'll be your nurse today. What's your name?
Isaiah Boyle.
Isaiah. Nice to meet you. I'm going to perform hand hygiene, wash my hands. Can you tell me your date of birth, Isaiah?
November 6, 2007.
Perfect. Good. Well, I'm here just to assess your thorax and your abdominal, okay? Any questions? Okay, let's get started. All right, I'm going to close the curtain, provide privacy for my patient. Can I have you sit forward, sit up tall for me? Good job. All right. So first I'm going to assess your lymph nodes, okay? If you feel any pain at all, just let me know, okay? All right, so we have your preauricular, postauricular, tonsillar, submandibular, submantle, anterior cervical, posterior cervical, supraclavicular, and infraclavicular. Okay? No lymph nodes were palpable, which is a normal finding in a healthy individual. Okay? Good. So then we're going to move on to the thorax and lungs. Okay? First I'm going to inspect. I'm going to have you sit back just a little bit. Good. That's perfect. So the chest expansion is bilateral and equal. Patient does not seem to have any dyspnea, shortness of breath. Are you having any trouble breathing today? No? Great. Any pain? No. Perfect. And I'm also noticing that the AP transverse is 1 to 2, which is also a normal finding. No barrel chest noted. Sorry about that. Okay, the rate of breathing, I'm going to go ahead and count respirations for a full minute. The rate of breathing looks regular. After 1 minute, I see that the respiration rate is 14, which is a normal finding. And I'm going to go ahead and listen real quick. I'm going to have you take a nice deep breath for me, sir. Good. Patient's breathing diaphragmatically and the chest expansion is symmetrical. Okay? So palpating, tell me if you feel any tenderness. No? No tenderness noted at this time, no crepitation, and no lesions that are visual, no bruising, no skin is warm, dry, and intact. Okay? And no masses noted, excuse me. Okay. I'm going to go ahead and actually have you sit forward and turn on the diagonal for me. Checking for tactile fremitus. Can you scoot forward a little bit, Isaiah, please? Mm-hmm. Okay. I'm going to put my hands on your back. When you feel my hands, I want you to say the word 99, okay? Have you scoot this way just a smidge. There we go. Okay. Go ahead.
99, 99,
Good.
99.
Excellent. Okay, so when I felt on his back as he was saying 99, there was everything was equal. There was no abnormalities to it, which is good. I'm going to do the same thing. When you feel my stethoscope on your back, I want you to say the vowel E, and I want you to say E. Okay? Okay. Go ahead for me.
E.
Good.
E.
Good. Perfect. The agophony test is normal. Each time I had Isaiah say the letter E, it sounded like the letter E and not A, which is a normal finding. And now I'm just going to listen to your breath sounds on your back, okay? Excuse me. Take a nice deep breath. And last one. Good. There's no wheezing heard, no crackles, lungs sound good. What else? Does not sound like there's any fluid residing in those lungs based on the fact that the E's sounded like E's during that agopny test. Excuse me. And also with the tactile fremitus test, equal vibrations were felt, so no consolidations are in the lungs that are noted. All right, sit back for me, friend. I'm going to check cardiac next. So I'm going to lay you back just a little bit here. I'm going to go ahead and inspect and palpate for heaves and thrills. I'm just going to turn this a little bit. Okay, so let's see. I'm just going to go ahead and feel here. Here. Good. No heaves or thrills are felt or noted at this point. And I'm going to go ahead and auscultate cardiac. So I'm looking for aortic, pulmonic, herbs, tricuspid, and mitral. Good. Great. The heart sounds are equal, regular. S1 and S2 is noted. S1 is heard loudest at the apex. S2 is heard loudest at the bases. And, the rate and rhythm are all equal and normal. Okay. Let's check your peripheral, your vascular response here. So, whoopsie, sorry. You can lay down still. I'm going to just feel your pulses, okay? So we've got temporal. And look up for me, friend. And carotid. Good. Brachial. Okay. And radial. Okay. And then I'm also going to check. Let's turn this a little bit. Oh, whoops. Posterior tibialis. Dorsalis pedis. No edema noted to bilateral lower extremities or in bilateral feet. Pulses are all 2+. Last, I'm going to assess the abdomen. I'm going to inspect, so if it's okay with you, I'm going to lift your shirt up. Okay. Skin is warm, dry, and intact. Any pain here? No? Good. No bruising noted, no abrasions. That okay there? Okay. No lesions noted. Oopsie. I'm going to go ahead and auscultate. Oops, pardon me. So no lesions noted, warm, dry, and intact. I'm going to auscultate bowel sounds in all 4 quadrants. Bowel sounds are active in all 4 quadrants. If they were not active, I would listen for up to 5 minutes. Okay, and I'm going to percuss. Tell me if you feel any pain. No pain noted, which is a normal finding. I'm also going to palpate. I'll start with a light palpation. Okay. Tell me if you feel any pain, Isaiah, okay? No pain noted, so I'll do a deep palpation. Any pain?
No.
Any pain? Okay, no pain. So that's a normal finding. That's great. And last, I'm going to have Isaiah sit up, and we're going to do a fist palpation. Percussion. Excuse me. That will be checking for CVA tenderness, and that will be on his 12th rib. So have you scoot and turn. Okay, so I'm going to find that first rib. Okay. Any pain? Good. Okay, and that's a normal finding for no CVA tenderness. That concludes. Thank you, Isaiah. Nice working with you, my friend. And would wash my hands and say goodbye to my patient. Thank you.